My Lords, as I gave prior notice to the Noble Lady the Minister, I want to ask a couple of questions about the Leng Review into Physician and Anaesthetist Associates, which was published today, dealing with issues of high relevance to the concerns and the levels of dissatisfaction among resident doctors. Indeed, the review directly addresses some of the training issues for resident doctors, which are set out in this statement that the government says it's seeking to tackle, particularly rotational training and the lack of training places. So I have two questions. One, when and by what mechanism will Parliament, and particularly your Lordship's House, have the chance to discuss the Leng report, given the high level of engagement when the statutory instrument that created the GMC registration of PAs and AAs in February 2024, and the level of expertise in your Lordship's House? And secondly, and this reflects many questions with which I'm being bombarded by those concerned with these issues, some of the main recommendations of Professor Leng include the renaming of physician associates and anaesthetist associates as assistants. Professor Leng says they should not be seeing undifferentiated patients except within clearly defined national clinical protocols, says they should get at least 2 years' experience when newly qualified in secondary care before taking roles in primary care or mental health trusts, and says there should be a named doctor as a line manager, which really puts into the questions of people operating as so-called locum physician associates. Now, presuming that at least the first of these, the naming question, would require a new statutory instrument, others may or may not. Can the Noble Lady the Minister give me and all the other interested people some idea of how the government's planning to take this forward?
Can I start by just saying how up to date the Noble Lady is, as the report was only published this morning. And I think perhaps, if I'm absolutely honest, asking such detailed questions at this stage is possibly slightly premature. We have committed to bringing in an implementation plan which will be published in the autumn. I think the government commissioned work has been very detailed. Professor Gillian Leng has led the review, and it sets out the report sets out 18 recommendations that will give much needed certainty and clarity to staff and patients. The government is accepting these recommendations in full. And I think by doing this, the government has demonstrated its commitment to evidence-based policy informed by expert clinical advice, listening to patients and professionals. I look forward to the implementation plan coming forward and making sure that we get some clarity. I think one of the most dangerous things is the lack of clarity that has surrounded these positions. The debate had, quite frankly, become polarised and, in some cases, toxic. I don't think that's in anyone's interests. Of course, there will be conversations between all interested parties following the report's announcement today, and I look forward to discussions. I'm sure it will come back to this place at the appropriate time.